Hi, many women have fluctuation of their seizures, and seizures can cluster around the menstrual period and the cycle. And this specific pattern of epilepsy is unique and has relations to the hormonal changes during that cycle. And this pattern is called Catamenial epilepsy. So today I will tell you all about catamenial epilepsy, how to diagnose it, how to prevent it, and how to even treat it. Because I believe myself that knowledge is key, and explaining all of those information in an easy way from the doctor will bring you better chances of controlling your condition and even discussing those with your own doctor. The reason why catamenial epilepsy happens thought to be due to the fluctuation on the hormones, and that can affect multiple things. The brain is sensitive to changes in the hormones, especially the estrogen and progesterone hormones, which do fluctuate a lot during the cycle. And the second thing is that the processing of the anti-seizure medications can also change drastically with the changes of the hormones, especially the estrogen hormone. Also, there is another theory about the neural steroids and the sensitivity to some medications during that cycle. So all of those can be factors why the seizure changes a lot during the cycle. So first step is the diagnosis. The best way to make this diagnosis is for you as a patient to bring a handy seizure calendar or seizure diary with plotting all the seizures during the month when they happen, and also to plot the menstrual cycle when the bleeding happened and what part of the menstrual period is. And if you want to be extra handy and have way more information, you can do temperature testing in the middle of the period to prove that if you had ovulation cycle or not. Because if you have ovulation, there will be a rise in the temperature in the body, and that will be ovulatory cycle, and that is important because it has following the distribution of hormones, and there is no ovulation. Sometimes it happens, and that will create irregular periods and will be an ovulatory cycle, and that also has a different impact on seizure control. There are three patterns of catamenial epilepsy. The first pattern is called C1, and this pattern, the seizures happen around the bleeding, which is like few days before and few days after the bleeding, and this is called C1 pattern. And the second pattern is mid-ovulatory, called C2. C2 pattern happens in the middle of the period when the progesterone hormone is at the peak, and this is called C2. And then the third pattern is the late pattern called C3, or the luteal phase, and this happens in the later part of the menstrual period in the last few days. There is a new study that drastically changed everything we understand about catamenial epilepsy and those periodic patterns. This study was done by Maxime Bod and Vikram Rao from UCSF in California, and they studied long data from patients who were implanted with a responsive neurostimulation system, which can give us information about the seizure fluctuations during the times of days, months, and even years. So what happened is that they found that there are multiple different patterns of seizure fluctuations. The first one can be day and night patterns, so by diurnal patterns, and the other patterns can be between 1 to 2 or 3 weeks, and some of them even took months or even years. One year will be lots of seizures, other years will be low amount of seizures, and so on. So there are multiple different cycles and patterns that is different from one person to another. And they named them multiple patterns as circadian, ultradian, and ultradian patterns. And it is interesting that these patterns were seen with fluctuations in seizure frequency in women and in men the same. So it is much deeper than just the hormonal changes. But it's very obvious that women do have fluctuation in seizures around the menstrual cycle. All right, let's go to the treatment patterns. So we can treat the seizures based on the patterns that we understand of the catamenial epilepsy. The first type of treatment is maximizing the anti-seizure medications, and this is important because we know that the changes in the cycle can change the concentration of medication. So if we have high doses of the medications, that can help, and sometimes we can strategically increase the medications based on the type of the pattern or during the certain times of the month. And the second treatment will be especially in C1 patterns, we can have mixed hormonal treatment with progesterone or estrogen progesterone treatment, that we can give long-term hormonal treatment so that will prevent the fluctuations in the hormones, and that is very useful in C1 and in irregular cycle. The third treatment option, which is very well studied, is to give benzodiazepines during strategic times of the month. For example, if somebody is having C1 with seizures worsening just a little bit before the period and during the period, we can give benzodiazepines, and the best one that was best studied is clobazam, and we can give 20 to 30 milligrams a day during that time, like 5 or 6 days before the period, and continue to 3 days, like 10 days around the period, and that can be enough to prevent seizures from happening during the menstrual cycle. And there are some other treatments that we can use with some limited evidence. Some people found very good success and some people did not, which is acetazolamide, and that can be helpful in catamenial epilepsy. And the fifth one, which is more of an understanding of how this happens, and it's under research, is called neurosteroids such as ganaxolone, and those medications are being studied for catamenial epilepsy. So it is very important you have all those patterns and all those treatments. So log in all your seizures and take all those information to your doctor, and then your doctor will look at you. It's like, oh, this girl is so smart. She knows all those patterns and she's discussing all the treatment. So you take ownership of your condition and provide treatments that everyone can benefit from. And we have so many anti-seizure medications to choose from, and every medication is unique and not every one size fits all. So to know all about all the anti-seizure medication, you can see this video for all the information you need to learn about epilepsy medications, and stay healthy, and see you in the next one. Salam.